Chapter 25, Therapeutic Agents for the Immune System. We'll skip over the terms and definitions, but we will cover them throughout the lecture video. In this section, we have the select vaccines that affect the immune system. So over here, we have the pronunciations of them. As you can see, some of the vaccine names are pretty hard to pronounce. So it's nice that you have the pronunciations here. Then we have antitoxin vaccines, vaccines against viral illness. And then we also have select immunosuppressive agents for the treatment of autoimmune disorders in transplant rejection. Bacterial and viral microbes that cause disease and death have always plagued human beings. In addition to these invaders, the body may need to defend against internal assailants such as cancer cells or a misdirected attack from the immune system, like an autoimmune disease. The body has a built-in defense mechanism that helps protect it from invading organisms. From birth, a primary body function is to defend against invasion. So your body loves you more than anyone else. It is constantly trying to defend you and help you and do things for you. So no one loves you more than your body. The lymphatic system produces immune cells and helps the immune system function properly. The lymphoid organs are sites of residence, proliferation, and differentiation of lymphocytes, which are T cells and B cells, and mononuclear phagocytes, which are like macrophages. An example of that is macrophages. The many lymph nodes contain a large number of lymphocytes, monocytes, and macrophages. As lymph passes through the lymph nodes, immune cells filter the fluid from debris and microorganisms. In an infection, microorganisms activate lymphocytes and lymph nodes to fight infection. The bone marrow, thymus, tonsils, and spleen are larger organs of the lymphatic system, each with special functions. So here is an overview of the major lymphatic organs in the body. So we have bone marrow, spleen, lymphatic vessels, lymph nodes, thymus, and tonsils. Figure 25.2 shows you just the anatomy of a lymph node. Bone marrow is important in immune and hematological system cell production. Hematopoiesis or blood cell production takes place in the bone marrow. The thymus is in the upper chest. Its primary function is to produce and educate lymphocytes, which ultimately circulate through lymph nodes and lymphatic tissues, and they help provide immunity. The thymus begins producing these lymphocytes before birth. As such, the organ is larger in childhood than an adult. So it has even been said that some adults don't even have a thymus anymore. Spleen is the largest lymphoid organ, and it sits on the left side of the upper abdomen. The spleen filters large amounts of blood cells as they reach the end of their life cycle. The spleen is also the primary site for immune responses to bloodborne diseases. The spleen contains approximately 25% of all the body's lymphocytes. The immune system has many specialized cells. Leukocytes are white blood cells, and their function are described briefly in the following list. Neutrophils are the most abundant leukocytes in adults, accounting for approximately 55% of the total leukocyte count. They are the first cells to the site of inflammation and act as phagocytes. Phagocytes ingest and destroy other cells, like bacteria and debris. Laboratories test neutrophil cell counts to determine whether a person has an infection. In healthy adults, eosinophils account for approximately 1 to 6% of white blood cells. They fight parasitic infections and form allergic responses. Macrophages are powerful phagocytes important in immune and inflammatory responses. The bone marrow produces immature macrophages, monocytes, which migrate to tissues where they mature and fight infections. Macrophages also ingest dead or defective cells. They additionally act as antigen-presenting cells. This means when macrophages come in contact with an antigen in the tissues, they migrate to the lymph nodes to signal T and B cells to gear up to fight the infection. Mast cells play various roles in the immune system, including wound healing and pathogenic defense. However, mast cells are best known for their role in allergies and anaphylactic reactions. They contain histamine, which they release during an allergic response. Natural killer cells are lymphocytes that specialize in killing tumor cells and some virus-infected cells as part of the innate immune response. The bone marrow produces NK cells to circulate through the bloodstream. T cells or T lymphocytes contribute to the adaptive immune response. The thymus produces T cells that remain in the spleen and lymph nodes until they are activated by APCs, antigen-presenting cells, to attack an invading pathogen. B cells or B lymphocytes are another important lymphocyte that acts as antigen-presenting cell. B cells can also differentiate into plasma cells that produce antibodies against pathogen invaders to help clear infection. We can divide the immunity response into 1, innate immunity, and 2, adaptive immunity. Innate immunity involves immune system cells that respond rapidly to infections. Phagocytic cells migrate to infection sites and begin to ingest bacteria or other antigens. These cells, in turn, release cytokines to facilitate the inflammatory response to infection. APCs at the inflammatory site response process the antigen for presentation to lymphocytes in the lymph nodes. This helps mount the adaptive immune response. So you can see figure 25.7 kind of shows you what the difference is between innate and adaptive immunity. Infection, allergic reactions, or injury can cause inflammation. Inflammation is a necessary response to injury, along with inflammatory swelling. Other effects are felt rather than seen. Vasodilation occurs during inflammation, allowing more blood to reach the affected area. The increased blood flow creates a warmer area. Edema, which is a buildup of fluids in the surrounding tissues, may develop. Inflammatory conditions can be either acute or chronic. Acute inflammation characteristically lasts a few days. The body might recover without medications. Chronic inflammation can arise from acute inflammation or injury. Chronic inflammation can occur locally, such as at a cut on the surface of the skin, or systemically throughout the body. Anaphylaxis is the most severe case of an allergic reaction. It can be deadly without immediate treatment. For most people, allergies are inconvenient but not life-threatening. Although the immune system can efficiently recognize and eliminate invaders, it can sometimes mistake normal cells for foreign material and mount an immune response against healthy tissues. We refer to this as an autoimmunity. There are several autoimmune disorders. Type 1 diabetes mellitus is one example. In type 1 diabetes, immune system cells attack and destroy the insulin-producing pancreatic beta cells. Therefore, type 1 diabetes patients require insulin treatment to manage their blood glucose levels. Other autoimmune disorders include Crohn's disease, myasthenia gravis, and certain dermatological conditions like psoriasis. This chapter discusses systemic lupus erythematosus, RA, Graves' disease, and Hashimoto thyroiditis, known as Hashimoto disease. In many autoimmune disorder treatments, the therapy aims to suppress the immune system. Therapies known as biological response modifiers are targeted therapies that can turn off certain immune cells or neutralize cytokines in an effort to diminish a destructive inflammatory process. Table 25.1 lists select biological response modifiers and immunomodulators for treatment of autoimmune disorders and transplant rejection prophylaxis. We have calcineurin inhibitors that are indicated for transplant rejections, rheumatoid arthritis, and severe psoriasis. So you'll kind of see that a lot of these medications cover multiple autoimmune disorders. Tacrolimus is usually given for organ rejections. We have antimetabolites like Salsept or Myfortic, which are for solid organ transplant. We have Emuron and Azosan, which is for renal transplant and rheumatoid arthritis. We have Rapamune for renal transplant, Zortress and Affininator for transplant rejection prophylaxis and cancer treatments. We have DMARDs, oral disease modifying anti-rheumatic drugs. So methotrexate, very popular drug. It has all of these indications: breast cancer, transplant, lymphoma, leukemia, osteosarcoma, and psoriasis. We have sulfasalazine, which treats rheumatoid arthritis and ulcerative colitis. Glucocorticoids, we have prednisone, which is for many different things. This table lists multiple sclerosis. We have the same for prednisolone, also treats asthma. Dexamethasone, which treats endocrine disorders, asthma, and multiple sclerosis. We have Humira. These are all TNF alpha inhibitors, which are also sometimes referred to as biologics. So we have Humira. I'm sure you've seen commercials for it, a very popular drug. Look at all of the things it treats. It treats Crohn's disease, ulcerative colitis, psoriasis, rheumatoid arthritis, ankylosing spondylitis. And you can see that Cimzia is indicated for most of those things. Enbrel is indicated for some of those things as well. Simponi, same thing, and same with infliximab, Remicade. We have biological response modifiers, the interleukin antagonist. So Kineret, which treats RA, rheumatoid arthritis, Actimera, which treats rheumatoid arthritis and systemic juvenile idiopathic arthritis. We have Simulec for solid organ transplant. Then in the biological response modifier category that are lymphocyte-specific agents, we have Orencia, which treats juvenile idiopathic arthritis, psoriatic arthritis, and rheumatoid arthritis. We have Belatacept, which treats kidney transplant rejection, Rituxan, which treats many cancers and rheumatoid arthritis, Benlysta, which treats lupus, Copaxone, multiple sclerosis, Tysarbi, multiple sclerosis and Crohn's disease, Campath, B and T cell cancers, leukemia, transplant prophylaxis, and multiple sclerosis. The interferons, beta 1B and beta 1A, both treat multiple sclerosis, and the anthracynidiones treat multiple sclerosis, prostate cancer, and acute non-lymphocytic leukemia. So systemic lupus erythematosus is commonly just called lupus. It is abbreviated a lot as SLE. It's a chronic inflammatory disease that can affect many tissues and organs, including the joints, kidneys, skin, GI tract, cardiovascular system, and nervous system. So again, it's just going to list some of the medications that we talked about in that chart. Rheumatoid arthritis, it's an autoimmune form of arthritis that is painful and can lead to bone and joint deformation. More women than men have RA, and juvenile rheumatoid arthritis affects children. In RA, joint inflammation leads to erosion and bone and cartilage remodeling. This makes movement extremely painful. As the disease progresses, joint deformity becomes irreversible. Therefore, treatment approaches to RA target both symptomatic management and prevention of joint destruction and disability. Treatment for RA includes physical therapy, medications, and diet. Figure 2510 shows a severe rheumatoid arthritis case. And again, just going over the medications that are for that we talked about in the chart. Graves' disease is an autoimmune disorder that results in thyroid gland overstimulation leading to hyperthyroidism. Graves' disease is the underlying cause of 50 to 80% of cases of hyperthyroidism. This is seen more commonly in women. And then some medication for hyperthyroidism. We have PTU. We have methimazole. For Hashimoto thyroiditis, the most common cause of hypothyroidism. So hyperthyroidism is overactive, higher working thyroid. It's working higher than it should. And hypo means low. That's a low functioning thyroid, not functioning at the amount it should be. It's characterized by autoimmune mediated destruction of the thyroid gland. The autoimmune disease is believed to be due to a combination of genetic and environmental factors. Infection, stress, pregnancy, iodine intake, and radiation exposure are known to be possible precipitating factors for Hashimoto thyroiditis. Another use of immunosuppressant agents is in organ transplant rejection management. Because organ transplants involve foreign donated organs, a risk with transplantation is transplant rejection. To avoid transplant rejection, health providers use immunosuppressive drugs to suppress the immune system and keep the organ viable. Immunosuppressed individuals risk infection when they are around people who are ill. It says in some instances, the risk warrants face masks and isolation. So our book was written way before COVID was a thing, but you remember probably pretty well that immunosuppressed people were more susceptible and at risk for COVID. And you can see here that in the chapter itself, it's saying that they should wear face masks and isolate. So that was even before COVID. So here is some of our organ transplant rejection drugs. Historically, thousands of children died from diseases such as measles, mumps, or have been physically scarred by the effects of polio. Although children can still contract these diseases today, they are seen less commonly, and death is rare because of the widespread use of immunizations. Table 25.2 lists vaccines available in the United States in 2017. So the first vaccine, adenovirus, that is approved for military populations age 17 through 50. Anthrax vaccine, trade name was Biothrax, that is reserved in the event of a biological warfare emergency, also probably given, maybe not recently, but about 20 years ago or so, to military personnel. We have a hepatitis A vaccine. We have a hepatitis B vaccine. We have herpes zoster. That's for shingles, not for like genital herpes. We have two of those now, Zostavax and Shingrix. We have a vaccine for HPV. So this is for prevention of HPV. You can't just like get a vaccine after you have it and it'll go away. Of course, we have influenza A and B. Those are your general flu shots. And those change every year based on what the flu looks like in the year. We have a immunization for Japanese encephalitis, measles, mumps, and rubella, which I'm sure we've all had or should have had. Measles, mumps, rubella, and varicella. So varicella is for chicken pox. So my generation, we didn't receive the vaccine. We just all hung around each other and got chicken pox. Now there is a vaccine, so it makes it a lot easier for people to not get it, which is great. We have some meningitis vaccines. So Menactra, Menovio, and Trumemba. We have pneumococcal, so pneumonia, Prevnar 13, the newer one, and pneumonia vax 23. We still have the polio vaccine, the rabies vaccines. We have a rotavirus vaccine. We have, of course, tetanus vaccines. We have a vaccine for pertussis, which is the whooping cough. We have a tetanus toxoid. That's actually for that's actually a tetanus shot, and this tetanus reduced diphtheria is for diphtheria. We have a typhoid vaccine, a smallpox vaccine. Again, the varicella is for chickenpox, and then we have a yellow fever. In rare cases, a vaccine can cause an allergic reaction. So we usually have the patients sit for 15 to 20 minutes so we can observe if there's any severe reactions after the vaccination. When practitioners immunize children and adults, communities are better protected against diseases such as chickenpox, measles, and influenza. People with weakened immune systems, such as older adults, chemotherapy patients, transplant recipients, and individuals with acquired immunodeficiency syndrome, AIDS, are also at higher risk of developing and even dying from communicable diseases. So, Table 25.3 lists the vaccine immunization schedule, recommended schedule from birth to 18 years. Kind of interesting. Table 25.4 lists the Centers for Disease Control and Prevention. It's recommended adult immunization schedule. So this one's also kind of interesting. So this is after 18. You should be getting a Tdap at least every 10 years. That's tetanus, whooping cough, and something else is, diphtheria. Influenza is recommended yearly. Now they recommend the HPV prevention vaccine between 19 to 26. Again, during my generation, that wasn't a thing. We have the MMR that should be given between 19 through 26 as well, and the varicella. The administration of vaccines results in the development of active acquired immunity. Vaccines can either be live or inactive. Live vaccines must be attenuated, which means weakened, so that they do not cause the disease. Once the body manufactures antibodies against the injected antigen, it has long-lasting immunity. Some available vaccines, like measles, mumps, and rubella, oral polio, oral retroviral, intranasal influenza, smallpox, and varicella, contain live viruses that have been attenuated before they're given to patients. A person with an active immune system quickly begins to make a full complement of antibodies and antigen-induced reactions that produce immunity. The advantage of live vaccine administration is the durable and complete immunity produced. However, if a person is immunocompromised, live vaccines could carry a risk of disease and other problems. An activated viral vaccine is one in which the virus products are grown in culture, and the virus is then destroyed so that it cannot replicate and cause disease. The typhoid vaccine is an example of a live attenuated bacterial vaccines. Some vaccines are referred to as toxoids. These are inactivated bacterial toxins. Although the bacterial cell has been altered so that it cannot cause disease, it still can induce an antibody response in the body. The two most common vaccines are inactive and live attenuated vaccines. Other less common types are available. The vaccines are slightly different in their composition from the usual types. So here is a list of less common vaccines and their specific characteristics. The storage of vaccines is controlled by the CDC guidelines for the vaccine's effectiveness. Most vaccines should be kept at temperatures between 2 degrees Celsius and 8 degrees Celsius, which is also 36 degrees Fahrenheit and 46 degrees Fahrenheit. However, some vaccines require freezing, like varicella, until the time of use. Always refer to the storage information for any vaccine product you receive to ensure proper storage and handling. Antitoxins and antivenoms are another form of antibody-based therapy that can provide protection from serious symptoms associated with acute toxins or envenomation. These agents contain antibodies that can neutralize dangerous toxins.